One of the primary muscle techniques that we use here in the office is called the active release technique, or you may hear ART for short. And what I do basically with that is I'll find an injured muscle that the patient's complaining about that day. So in this case, we're going to work the supraspinatus muscle, which is one of the primary muscles that's involved when you hear of rotator cuff injuries and things like that, or impingement, where the arm bone kind of gets pinched up when people try to lift their arm overhead. And so what you do with active release technique is you'll shorten the muscle first, and then I take a good contact using a thumb or some fingers, and I have the patient actively move their limb through a full range of motion, trying to stretch that muscle underneath the contact. So what I do first is I will do a thorough palpation or define the area that's involved. So I follow along the muscle here, the belly of the supraspinatus, and I look for some sort of balled up type adhesion or some sort of grittiness that indicates a scar tissue from some sort of injury. So in that case, then I start the patient up, shortening the muscle. I will take a contact just underneath the adhesion I found, then a little bit of pressure, scooch in, and then I instruct the patient to go ahead and move through the range of motion. So he's going to go behind his back, reaching for that opposite hip, and I'm increasing my pressure and breaking up that adhesion. Good. That's one pass, and then I instruct him to come back through again, and we'll do a couple more. So I go right back up to the spot, get my tension, and have him go right through again. Perfect. Good. And then we would usually do about 3 to 5 passes per muscle that we do each session. And if I'm treating an entire shoulder injury, I will work that muscle in addition to the other rotator cuff muscles. So that's just a quick preview of active release technique.